and welcome. Thanks so much for joining us for another pre-arrival webinar. Today, we're going to be talking about student health. We have some wonderful colleagues to discuss insurance and immunization requirements here at UC San Diego. My name is Grace Fuller. I serve as the Manager of Student Experience and Engagement at ISPO, the International Students and Programs Office here at UC San Diego. And I'll hand it to my colleagues. We can just go down the line to introduce themselves.
Hello, everyone. My name is Gabby Hoffman. I'm the Assistant Director for Student Experience and Engagement. I work alongside Grace here at ISPO. I'll go ahead and pass it to Jill.
Good morning. My name is Jill Batika, and I'm the Billing and Insurance Manager at Student Health Services on campus.
And good morning. My name's Annie Horton. I'm the Director of Nursing from Student Health and Wellness and work with Jill.
All right, a little bit of housekeeping before we begin. So you'll find that you are in listen-only mode, which means you can hear us, but unfortunately we can't hear you. So the primary way that we'll be interacting today is through the Q&A feature on your Zoom menu bar. We will be covering a lot of good information during today's presentation, so please know that we will have an open question and answer session at the end of today's webinar. And we do ask that you let our panelists get through a lot of that good information before submitting questions, because you might find that some of those questions will be answered, hopefully with today's presentation. But if for some reason we aren't able to get to your question, you can always submit a follow-up question at icontact.ucsd.edu. And then finally, we are recording. So you'll be able to view this webinar recording as well as other previous webinars at iwebinars.ucsd.edu. And you can click on webinars for newly admitted students. That's just a friendly reminder of kind of what that Zoom menu bar looks like, or the Q&A feature. Again, the chat has been disabled for attendees, so we as panelists might be dropping relevant links in the chat for you. But again, the primary way that you'll interact with us is through that Q&A feature. Okay, so we are excited to have some friendly reminders about first steps checklist from our office, ISPO, then hand it over to our colleagues to discuss health services, immunization requirements, insurance requirements, and then we'll end with some last reminders before we transition to our open question and answer session. And so with that, I'll hand it over to my colleague Gabi to talk a little bit about our first steps checklist.
Yes, so hopefully all of you have gotten an opportunity to take a look at our first steps checklist on our ISPO website. This is our, what I would consider, one-stop shop for international students to get started with some of the key pieces to obtain your visa and to get started at UC San Diego. So on the iNewStudent.ucsd.edu webpage, this is housed within the ISPO website. If you go here, you'll see that we have pages dedicated to our undergraduate students. So if you click on undergraduate students, you'll be taken to our first steps, which goes through everything from requesting your immigration documents, how to prepare for arrival, and then what to do once you arrive at UC San Diego. So we encourage you to take a look, go through each of these lists, make sure you're checking everything off and meeting all the requirements to get started here. I'll go ahead and pass it over to my colleagues.
Great. Good day. Again, my name is Jill Batika, and I am the Billing and Insurance Manager here at Student Health on campus. I'm here to provide you with some information regarding the health insurance requirement and what our Student Health Clinic has to offer you while you're here on campus. Just a note, I'm going to be referring to the Student Health Insurance Plan as SHIP, or UC SHIP, so you'll hear that a lot. The insurance plan is underwritten by Anthem Blue Cross PPO and is recognized nationally throughout the United States, and it does provide global coverage. This is our site right on Library Walk. It's this brown wooden building. You'll find us right across from the Price Center Eateries, and this is our team of insurance agents and billers. Our Student Health Clinic is a comprehensive primary care physician clinic centrally located on our school campus on Library Walk, right down from the library and across from the Price Center Eateries. We provide physician and nursing services. We have a laboratory, x-ray unit, pharmacy, and an optometry showcase in our clinic. Services are available to all UC registered students. We don't service the staff or public, so it's only for the students of the UC system. And you can utilize any of the student health clinics throughout the state of California at any of the UC campuses. We're open all year round, and we have varying hours of operation during the summer. Appointments can be made through MyStudentChart or by calling 858-534-2918. If we are closed, we do have registered nurses that answer our phone line and can advise you at the next level of care. We're here for all students, and it's not just for the students that have our insurance through the school. The health insurance is a non-academic requirement of any student that attends a University of California campus, grad or undergrad, international or domestic. There are no exceptions. Everyone must have insurance. The insurance offered to students is referred to as a health fee on your registration fees on your student account. This academic year, the cost per quarter is $671 for undergraduates. This is charged to you 3 times, in the fall, winter, and the spring. And when you pay the spring quarter fees, you're covered for this summer until you come back for the next fall quarter. The insurance coverage provides for health and pharmacy unlimited, and they provide $1,000 worth of curative dental services. And we have a vision benefit that's limited as well, but it will afford you an eye exam and some glasses so that you can see. And that's important as a student here. Coverage is provided worldwide, and if you are traveling for work or school or for fun, Anthem Blue Cross, you can contact their global coverage and get instructions on how to access care if you're outside of the United States. At the University of California, many of our schools are lucky enough to have a major medical center near their campus. We are one of them in California. We have 2 major hospital systems near our campus, and they house over 200 outpatient specialty physician programs with state-of-the-art diagnostic and surgical interventions. UCSD Jacobs and UCSD Thornton hospitals are right across our freeway from our campus, and we have shuttles, and we also have other rides that are available that will get you over to get that care. We also have a comprehensive hospital in downtown San Diego, so we have lots of opportunities for you to get the care that you need. Students that utilize a UC provider or a facility will be covered at the highest rate possible under the insurance that's offered. If you utilize the UC system, it's a $10 copay to see a specialist, and 90% is covered for any hospital-based services or diagnostics. Students may want to use the second tier of coverage under Anthem Blue Cross PPO. Students that choose to see a non-UC provider, and their provider is Anthem Blue Cross contracted, will pay a $30 copay for consultations, and 80% is covered for any hospital-based services. There is a $500 deductible that applies for any of these services, and a deductible is what is paid by the student before the insurance kicks in. The third tier benefits is referred to as out of network, and we strongly discourage this because there's a $1,000 deductible that needs to be paid first, and then the insurance company will pay 60% of those charges. And those are usually providers that ask you to pay up front. So try and stay within the first 2 tiers of benefits and you'll achieve the most coverage. We don't send out insurance cards to be ecologically minded. So we have an app that you can download to your mobile device or your phone. Just search for the Student Health, all one word, and that will download a copy of the insurance card as well as allow you to visualize any claims that are being processed under your name. Our websites are provided for you there, so you can take a look at the benefits and the details that go along with utilizing the insurance and accessing care at Student Health. If you have insurance under your parents, privately, or through a government entity that meets our waiver criteria, you may file a health fee waiver on the Triton link to avoid paying the health fee each quarter. You're welcome to use the Student Health Clinic for care, but you will be charged for the services. Students that waive the insurance through the school will be charged on a fee-for-service basis. So every service that you have provided at Student Health, you'll pay for here in the clinic, or we'll transfer it to your student account where you can pay it at the same time as your tuition fees are due. To access the waiver, you go to the Triton link. and click on the health fee waiver. You fill out an application and download a copy of your insurance card front and back. A decision is made. You just have to file it during the open timeframes before each quarter if you want to avoid paying that fee. So the waiver is open currently for registered students. That started May 3rd and will be open until September 10th. We have a late waiver period. If you miss it during that May 3rd to September 10th opening, will be open until September 15th with a $50 late fee attached. So try and do it during the time frame that you don't have the late fee. And if you do it before the fall quarter, that will waive you for the entire school year, fall, winter, and spring. You just have to renew it each academic year. Many international students opt to purchase online health insurance to waive the student health insurance plan. These are 3 that we recommend that do meet the waiver criteria, and the University of California Office of the President will approve the waiver if you use these plans. We don't have any affiliation with them, and we don't accept them in the student health clinic. But if you pay for your services at Student Health, we can provide you with a receipt that you can try to send to this insurance company to seek reimbursement. Students that choose to waive the school offered insurance are still welcome to Student Health. You just need to pay as you go. One office visit at Student Health runs about $99 to see a physician, and charges add up depending on if you need lab services or x-rays or anything additional. Payment is expected at the time of service by credit card, or the fees will be transferred to your student bursar account where you can pay them. You may print out receipts from MyStudentChart to use and request reimbursement from your home insurance company. You can file a cancellation of your waiver or an exception to closed enrollment if you do lose your home insurance and you want to be enrolled in the school insurance. You just need to contact our offices and we'll assist you with that. If you do choose to waive the school offered insurance, you'll be asked on the waiver application if you'd like to grab a RAFT, and that RAFT stands for Reduced Access Fee for Tritons. This is not an insurance, but it is basically a membership to come into the student health clinic here at UCSD to have scheduled appointments unlimitedly and in-house lab services if you pay $70 per quarter. You avoid paying the health fee, but you pay $70 and will allow you to come into the student health clinic and have as many scheduled appointments and lab services as you'd like during a quarter. It is, again, not an insurance, and it doesn't pay for any services outside of the student health clinic. It just pays for that quarter for you to have unlimited amounts of scheduled appointments and in-house lab services. It doesn't pay for any pharmacy prescriptions, any specialized send-out labs, optometry, or immunizations. We also have more information about this on our website if you'd like to check that out. Our contact information is provided there for you. If you do have any questions about what we discussed today and I don't answer you here in this forum, please contact us at our phone number 858-534-2124 or send us an email at ship3@ucsd.edu. and we'll be glad to answer you generally within 48 hours. We also offer face-to-face Zoom conferences Monday, Wednesday, and Friday, and that is open from 11 to 12 p.m. Pacific Standard Time. And the links are on our website at the studenthealth.ucsd.edu site. Thank you for your time today, and I will be glad to answer any of your questions.
Good morning, everybody. My name is Annie Horton, and I'm the Nursing Director, and I'm here to talk with you about the UCSD incoming health requirements for fall 2022. Welcome to you all, and thank you for joining us, whether you're joining us live or you're listening in on this at a later date. Welcome, and I'd just like to outline exactly what we need from you for incoming TB immunizations and the COVID vaccine. So why do we have incoming requirements? It's really to protect the university community, yourself, your friends, and we have seen firsthand what outbreaks look like in all settings, and We really want to prevent as many vaccine preventable outbreaks as absolutely possible on campus. And so all of the requirements really focus around things that are very easily transmissible. And that's why we require them. So the incoming requirements include tuberculosis screening, regular immunizations, and I've listed them there, and also the COVID-19 vaccine, which is a new addition. And the deadline for everything is July 11th. And so starting the process, and really the first thing that is needed is that you activate your student health portal, and that is called MyStudentChart. And you just use your student AD login, which is your UCSD email and password, and that is issued at some point after accepting an offer of admission at the university. And for undergraduates, all of this information and all the links are on your Triton checklist, so it's very easy just to go directly to where you need. So this is what MyStudentChart looks like. It's the student-facing portion of our electronic health record called EPIC. It's private. Your information is protected. It is not shared. It is housed within a very safe space. So once you have used your student AD login, you will come onto a welcome page. And to get to where you need to go to the menu, and pretty much everything within this portal sits on that menu. And the one that we're utilizing primarily is the immunizations and screening. There is also a new section called COVID-19, and you can choose to enter your COVID-19 vaccines there. And this is what it looks like once you go in there. You will see two spaces, one for TB screening, one for immunization history screening. And so when you click on either of those, it will take you to the next part of the process. For the TB risk screening, the system will ask you to answer a series of questions, and then the system will determine whether you are at slightly higher risk for tuberculosis. So if you are prompted to do TB testing, you will be asked to download a form and take that to a healthcare provider, where you can choose to do whichever type of TB testing is available to you. And that could include skin testing or a blood test called a quantiferon or a T-spot test. The other option is submitting a chest x-ray, and that's fine if you can't obtain, or it's easier for you to obtain that than a skin or a blood test. Once you've done this testing, you can return back, and there'll be an upload button, and that comes through to myself and the nursing team, and we will review your testing and enter that into the system and clear you if everything looks good. If there is anything at all missing or anything additional needed, then one of our team will send you a message. So it's very, very important to return to the electronic medical record into MyStudentChart to see if you've received a message, because sometimes students don't realize and don't return back there, and there's something additional that was needed and a hold could have been avoided. Excuse me. There is a section within MyStudentChart called messaging, and you can reach out to us, and it's called Ask a Nurse. You don't need to have been seen by our clinic. It's available to you at any time, and there are RNs responding to the Ask a Message, generally speaking, within office hours, although we do also have nurses checking that through the weekends and evenings as well. But I would, at the busy times, allow for, generally speaking, we will get back to you within 24 hours. But it's really important to get on to all of these requirements, because failing to do so will result in an enrolment hold. The next part of it is the immunization requirements. And so the vaccines that we require, the regular vaccines, is Tdap, measles, mumps and rubella, varicella, and meningococcal vaccines. So there's also an immunization form that you can use if you don't have any accurate vaccine records. You can do either or both, whichever is easiest for you. And if you have gaps, you're missing vaccines, you need blood tests to check for immunity, which is also acceptable for measles, mumps, rubella, and varicella. And varicella is the chickenpox. You can get a blood test. So you can take the form with you to your healthcare provider to assist in guiding them as to know what it is that we're looking for. The University of California has this year, I can't remember when we first started it, probably last year, instituted a COVID-19 vaccine requirement. And what we are presently requiring is that you've received a primary series and 1 booster dose. Now, this can be any of the vaccines listed here. They need to have been either FDA, which is US-based, or World Health Organization approved vaccines. And currently, this is the list of approved vaccines. So unfortunately, if you have received one that isn't on this list, you may need to repeat your series, but we will have it available here on campus for when you get here. So even though our deadline is July 11th, if for some reason you have been unable to obtain a WHO approved vaccine or successor or a booster dose, or your particular country or city is in lockdown and it's extremely hard to access, then you can reach out to us and we will help you with that situation. There are exemptions available for medical and religious reasons, and I'll talk a little bit more about that in the next slide. And we can temporarily postpone for pregnancy and for other reasons as well. And as I say, we run a very large vaccine clinic on campus, so you will be able to get vaccines that you may not have been able to get. This is the exemption and deferral process, and this can be found, more detail for this can be found on the Return to Learn website. But these are the types of exemptions that we are allowing for disability, religious, remote, and medical deferral or partial vaccination. So just so that you're aware of this exemption process. But if you need to take this process, I would recommend taking it early because it does take a little bit of time to work through. When you are in the immunization requirements section of MyStudentChart, you will be asked to both enter the dates of your vaccines or titers and upload vaccine records. And this is what it looks like. And if you hover over the little eye bubble next to any vaccine, it will give you additional information as to what it is that we're looking for. And really, the important message is how to get additional help for this. And as I mentioned, the Ask a Nurse function and messages in MyStudentChart is really the best way of getting information. We do have an email address there that comes through to our medical records department. That is primarily for technical difficulties. Please don't send any health information that way. Email is not always the safest way of sending health information, but you can certainly ask our medical records team if you're having technical issues, and we can guide you to the right place to help sort those out. Our student health website has lots and lots of information, and there's a section there that I put up earlier that takes you to the incoming requirements page, and I've got all info on there, forms and links and all sorts of helpful information to guide you through that. The graduate division, which isn't appropriate for this audience, but they also have info, and it's Triton link for undergraduates that you would find that information. The Return to Learn website is there for COVID-19 related questions. And just again, please return, once you've done your submissions, please return back. We will let you know once you've achieved compliance. And however, around deadlines, it takes, we have an enormous volume to work through. So the immunization portion of it, as long as you have entered your dates and submitted, there will be no academic hold, even if you are missing something, because in various parts of the world, certain vaccines are not available. For example, the Tdap vaccine is not widely available internationally, and you can get that once you come to campus. We run flu vaccine clinics right through the fall and winter quarter, and we also have COVID-19 there, and also the Tdap vaccine available. So it's very easy for you to obtain those vaccines. If you get UC SHIP, those are all covered under that. If not, there are places very close to campus where you can obtain the Tdap vaccine or any other vaccines that you're missing. If you have UC SHIP, you can also come into the Student Health Nurses Clinic where we can help catch you up on any missing vaccines. That is not true for the tuberculosis. We really need you to have done your TB screening and testing before coming to campus. So you will need to follow that process right through to avoid an academic hold. The academic holds for TB do go on not long after that deadline date of July 11. So it's very important that you attend to that quickly. And that's it. Please feel free to reach out through MyStudentChart if you have any questions.
All right, thank you so much to Jill and Annie for sharing so much good information. I'm going to go through a few opportunities for you to already start getting involved here at UC San Diego. So the first thing I'd like to highlight is our Global Ambassador Program, which we often refer to as GAP. So GAP is a summer-long peer mentoring program designed to assist our incoming undergraduate international students in just acclimating to the new environment here at UC San Diego and life in the US, and just making a smooth transition. So our GAP mentors are continuing students. When you fill out the GAP mentee application, you can note what is most important to you in a mentor. So maybe that's having a mentor from the same home region as you. Maybe that's having a mentor in the same college, potentially with the same major. So again, you'll rank your order of preference, and then we'll do our best to match you with a continuing student that kind of meets some of those qualifications. You can learn more at gap.ucsd.edu. And then I'm also going to go ahead and put the GAP application in the chat so that you can go ahead and fill that out as well. All right, but then I'm also wanting to share about our international peer coaching program. So if GAP is our summer peer mentorship program, then IPC, International Peer Coaching, is our year-long. So this is during your first academic year at UC San Diego, open to both first-year students as well as transfer students. And we have an international peer coach designated for each college. So if you're going to enter into UC San Diego, you'll be assigned to a college, and you will actually have an international peer coach for you in that college. This is a voluntary program that you choose to enroll in, but we find that a lot of our students find this extremely helpful, just to have someone to ask questions to kind of help them navigate, as there's so many things to transition to, especially when you first get here. And so I do strongly recommend that you check this out. You can find some of that contact information listed on the screen. And yeah, we hope that you'll enroll in the International Peer Coaching Program. And then finally, we hope that you'll engage with us on social. So our handles across platforms are at ispo.ucsd. We like to have a lot of fun and engage with our student audience. So one example of that is our team has actually created Instagram filters celebrating your admission into UC San Diego. So you can go to our Instagram page, go to the filter section, play around with some of those filters. You can see one of our students playing around with it on the screen. And if you post that to your story and tag ISPO, we would love to reshare it and celebrate you and the fact that you are joining our Triton community. And with that, I'll hand it over to my colleague Gabi to talk about some additional resources.
Thank you, Grace. Yes, just wanted to go over some additional pieces here that might be of help to you as you're planning your studies here. So the first page I wanted to direct your attention to, I know that we are thankfully in some areas of the world coming to tapering of COVID-19, but there are of course many after effects and continuing impacts with COVID. And so we want to make sure our students are aware of these impacts as it might affect potentially enrollment or visa delays, immigration documents, travel, that sort of thing. We are keeping up to date with how the pandemic is continuing to impact some of these pieces. And we post all of that information on our iUpdates page, iupdates.ucsd.edu. This was just updated last week. And we'll provide the latest information regarding study with hybrid, study with in-person classes, all of that, how that impacts your visa documents and so forth. So please check it out as soon as you can. This will give you a good idea of what to expect as we head into the summer and the fall. I also want to direct you to returntolearn.ucsd.edu. I know Annie mentioned this and directed students in our presentation a little bit earlier to this page, where a lot of information lives about how the university has responded to and is continuing to respond to the effects of the pandemic. This is also where information can be found on the vaccine mandate, how to apply for exemptions if that is something that you need to do. But in general, the returntolearn.ucsd.edu website is a fantastic resource to learn about, again, how the university is responding and upholding safety measures during the pandemic. You can also check out, there's a dashboard on daily case rates at the university, so you can kind of have a sense, a pulse on what things look like in the San Diego area and specifically at UC San Diego. All right, and then of course our vaccine mandates that we've been talking about, the vaccine mandate in place for this fall. Again, that deadline is July 11th, and all the information on the mandate, potential exemption requests that students can make if necessary is on the Return to Learn website. So that's listed here. So you can go through all the information, what is required. Again, that's not only the COVID vaccine, but also TB risk screening questionnaire, as well as immunizations. So all that information, how to do that process is here.
All right, and just a friendly reminder, we are well into our pre-arrival webinar season, but we do have some webinars coming up. So on May 17th, we'll be discussing campus safety. On May 19th, we'll be discussing finances and student accounts. And then on May 24th, we'll be talking about student life and getting involved here on campus. So again, iwebinars.ucsd.edu, click on webinars for newly admitted students, and that's where you can both watch previous webinar recordings as well as register for any upcoming webinars. Okay, so things you can start doing now, begin requesting your visa documents via the iPortal. You can also apply for on-campus housing. You can also start working potentially on some of those health requirements that we just discussed today with that deadline of July 11th. We have some of our upcoming webinars listed, and then we are so excited to welcome you in September at New International Student Orientation. And then the last piece is, again, we will answer a lot of questions today, but if we don't get a chance, you can always reach out to us via icontact.ucsd.edu. And we do have a feature on our website called Ask Triton. It's in the bottom right-hand corner. And oftentimes I know that students will almost use this function as like a search bar. So if you're curious about, hey, what about X, Y, and Z, you can type that and that will usually direct you. Our website is such a good source of information, but we also understand that it can be a little bit overwhelming at times and hard to know exactly where to go to find the information you're looking for. And so Ask Triton is a great way to do that. Okay, with that, we will go ahead and open it up to some question and answer. So feel free, hopefully you've been taking in all of that good information from our panelists today. But if you do have any questions that you still have, this is a great time for you to submit them now. So we'll give a couple minutes for that. And then depending on how many questions come in, we'll after proceed to wrap up our webinar. Okay, Annie, this might be a question for you. So we have a question that's come in that reads, I have taken 2 doses of the Pfizer vaccine, but here in Brazil, people under 18 can't take the booster yet. And I turn 18 in August. What should I do?
Excuse me. Yeah, very good question. That's totally fine. So you would go ahead and enter your 2 primary doses into the system. And then once you can access that booster, receive that, and you'll be able to go back and update with your booster dose as well. So that's totally fine. There won't be an academic penalty on July 11th for that type of situation. So you can just go ahead and enter the information once you have it available to you and once you've received that booster.
Wonderful. All right, we have another good question that reads, do I just submit the vaccination record myself, or does it have to be signed by some medical practitioner?
It doesn't have to be signed by a medical practitioner. You can, if you've got a vaccine record, we just have the form available to guide you. So it doesn't have to be signed by a provider. If you've got your own record, you can just submit that. If we need any more information, we will reach out to you.
All right, I'll give it one last minute before we wrap up, but I will just remind you that we've shared a lot of good links, as well as I think a lot of contact information in the chat. So please take note that our offices are here to support you starting now throughout your journey at UC San Diego. We're so excited to welcome you to the Triton community, and we look forward to interacting with you both virtually for now and then also in person when you come to the US and UC San Diego. So with that, thank you for joining us for our pre-arrival webinar today, and we hope you have a great rest of your day.